We have been waiting for quite some time since we received the information that the delegation from Johns Hopkins University was to visit us. And certainly we are very anxious to hear from you, from the little that you have heard so far about CCPmedicine, and we can't wait much more. Dean Helen MacKenzie, we welcome you to address us.
Wonderful to be here, and thank you for such a special morning. It was absolutely fantastic. We are thrilled to be here to celebrate with you your 5th anniversary, and I'm told it's the actual day of the 5th anniversary. That's wonderful. But Professor Kinyerezi Leamuya and Dr. Frank Manasseh, all our distinguished guests, from religious leaders to government participants from the community, donors, you make this all happen, and we're so pleased to be here with you to celebrate. It's so wonderful to see all the work that's been done, and from what I've learned about CCPmedicine, I think there are 2 magic ingredients, 2 things that really make it work. I think number 1 has got to be Dr. Frank. It's true that he came to Johns Hopkins, Bloomberg School of Public Health, and learned some tools and gained some knowledge. And it was a pleasure to have him at the school. But it's his real passion, it's his vision that really makes all of this work. It's just amazing to see what he's done. He had the vision. He said, you know, if you look at the future of the health of Tanzania, it's non-communicable diseases, and we have to take that more seriously, and we have to tackle the prevention of non-communicable diseases. He also had the vision of saying we can't treat the consequences, the outcome of these non-communicable diseases, because that's very expensive, and it takes lots of resources and lots of people, lots of facilities. What we need is to prevent these non-communicable diseases from occurring in the first place. And he's done that so well, and remarkably well, by forming partnerships with the religious community, with the government, with the community, and brought people together, and really taught the message of, prevention is what it's all about. We can do a lot to change our lifestyles, to change what we eat, to change what we do, to change how we go about our daily lives. That's going to reduce the prevalence of these non-communicable diseases. And I can't speak more admirably of that vision that he had when he came back to Tanzania. So that's the first magic ingredient. But it's clear, and I wrote a little about CCPmedicine, but today it really came to life. It's all about the community, and this community that Frank has pulled together. You are what makes this work. Together with, so Dr. Frank had the vision, great, but you all, from the donors, the volunteers, the leaders, the government, you are really what makes this work. And I thank you all so much for having the commitment to the program. We have a note for the School of Public Health, and some of you know it, I know Frank knows it very well, and it's protecting health, saving lives, millions at a time. And I can't think of any program that does this so much, so well than CCPmedicine. You are literally protecting health and saving lives every day. And it's just amazing to see. And I'm learning a lot about what we do as a school. But one of the first things I wanted to do was to develop a plan. How do we move forward? Here I am, coming in as the dean of the #1 School of Public Health. We already do amazing things. So I asked myself, well, what can I do to move the school forward? And we spent several months thinking about how we put that plan together and what that plan should represent and what that plan should be. And it included faculty, staff, students, and very importantly, it included our alumni. And we came down to the theme of our strategic plan of the power of public health. And again, I go back to thinking about what Frank has said and talking about the power of the community, the power of what you can do as a group together. And that's what public health is all about. So we very much believe that we need to unleash the power of public health through an emphasis on the power of education, the power of science, the power of partnerships, the power of people, and the power of advocacy. And you have taken each of those powers and you have applied them in an amazing way, and you're having a true impact on the health of your citizens and of the country. I was really pleased to see Frank starting to talk about hypotheses and saying, well, does this really work? We need data. So he was very trained, well trained in thinking about the need to evaluate the program. Because you know better than anybody that if you can show that this works in protecting health and saving lives and reducing costs, you can better sell this program countrywide. And my fervent hope, not only to see CCPmedicine grow and continue and to do all the great work for individuals and families, but I also hope that this model will be replicated in other parts of the country. Because I think that so impressed me was in talking to Frank and listening about the program here at CCPmedicine. What you are doing is you're bringing these messages, these prevention medicines and screening tools out into the community, out to where people live, where they work, and where they play. And I think that's the real beauty of the organization. You're not waiting for people to come here to a clinic, but you're hoping that you're reaching out to where they are, and I think that's the real power.
Baba to the